Welcome to Let's Talk Health 20th episode. I'm Mrs. Padma, working as Chief Dietitian at Star Hospitals, Banjara Hills. Today we have with us Dr. T. Lakshmi Kanth, Consultant Surgical Gastroenterologist, to discuss about the topic Bariatric Surgery and Nutritional Journey.
Hello.
Hello, doctor. సో ఇన్ ద మోడర్న్ లైఫ్ స్టైల్ చేంజెస్ అన్నీ చూస్తూ ఉన్నాం కదా రోజు మీకు ఎటువంటి ప్రాబ్లమ్స్ తోటి ఈ ఊబకాయస్తులు అనే వాళ్ళు వస్తుంటారు?
అంటే ఇప్పుడు ఒబిసిటీ కానీ ఊబకాయం కానీ ఇట్స్ అ వెరీ అంటే మోడర్న్ ప్రాబ్లం. ఆల్మోస్ట్ మనం చూసామంటే ఆల్మోస్ట్ వీఆర్ సీయింగ్ మోర్ దెన్ 20% to 35% ఇన్ డిఫరెంట్ ఏజ్ గ్రూప్స్. సో ఏంటంటే డిఫరెంట్ ఏజ్ గ్రూప్స్లో డిఫరెంట్ ప్రాబ్లమ్స్తో వస్తూ ఉంటారు. There are some category of people, youngsters, who have a very poor lifestyle, very bad dietary habits, and they're gaining weight very, very fast, who are less than something between 14 to 18 years. Then the other age group, adolescents, they have gone for this intensive training program, like, for the medical career or for the engineering career. They have been leading a sedentary lifestyle. Suddenly they put on weight for the past 2 to 3 years. The other group are women, so who are unable to conceive, so they want to conceive but their health, polycystic ovarian disease, is disturbing them. The other thing is they have lot of medical issues, but the medical issues are not being very easy because they take more and more medications, and the physician says until unless you lose your weight nothing will happen. And there are very other category of people where all surgeries like spinal surgery has been done, or even bypass surgery has been done, and when everyone has given up on them because you're overweight, we have done whatever is possible from our side, you have to lose weight. These are the people in between, అంటే అది 18 years నుంచి అవ్వచ్చు, 70 years వరకు అవ్వచ్చు. దిస్ ఇస్ ద క్రైటీరియా. అంటే ఈ ఏజ్ గ్రూప్కే వి అడ్వకేట్ బేరియాట్రిక్ సర్జరీ. ఎవరన్నా కానీ దానికన్నా తక్కువ ఉన్నప్పుడు, 18 years కన్నా తక్కువ ఉంది, దే ఆర్ ఇన్ ద వెరీ యంగ్ ఏజ్ గ్రూప్, దే హ్యావ్ నాట్ రీచ్డ్ 18, వాళ్ళకి సాధారణంగా డైట్ అండ్ మంచి లైఫ్ స్టైల్ మోడిఫికేషన్, అండ్ వి ఎంకరేజ్ దెమ్ టు టేక్ లాట్ ఆఫ్ స్పోర్ట్స్ అండ్ అదర్ థింగ్స్, అండ్ వి పుష్ ఆన్ till 18, take up, do everything what you can to lose weight and prevent from gaining weight. And lot of times ఏంటంటే younger age group, see, once they cross the adolescence, they go to engineering, they go into other habits like not only eating lot of this junk food, but also about alcohol. So these are also people we need to counsel them instead of directly going in for surgery. We counsel them that these habits are not good for you. And see, we often refer it to you, said, so diet, as you know, diet plays such an important role. See, before we take anybody, see, because in the borderline cases, BMI something like 27 to 33.5, we always encourage them, so take a good diet. And because diet is the primary focus, and along with that we'll add some sort of exercises with the help of a physiotherapist, and this is how we work on them. So most of the times at all category, preoperatively, perioperative, postoperative, dietitian plays a very, very important role, because see, there are always everyone are very particular with certain type of diets. We want that, so then we need to take the help of the dietitian to guide them, because they have been living because regional differences, and you have been used some sort of diet, then we take their help to adjust the diet according to their likings.
So basically only after all the other dietary regimens have failed, so this will be as a last resort to go for bariatric surgery.
Last resort. So one thing is, there is always a feeling that diet somehow will help, but diet has to work in every level. But whenever the body weight, excess body weight, is more than 25 kilos, or the BMI is more than 37.5, or the BMI is 33.5 with lot of comorbid like diabetes, hypertension, some people have severe sleep apnea, some people are not able to walk, young, they are only 45, 40, and the knee replacement surgeon says, you are not good enough, not old enough to undergo any sort of knee surgeries, the knee is getting spoiled. All these people, category of people, require some sort of help. So most important is, see, everyone should know that when they are obese, overweight, and they are having a lot of health issues, they have light at the end of the tunnel.
Yes.
So this is there. Not that everyone should come for bariatric surgery, but there is a way where you can become normal. You can get rid of all your health issues and still live normally. So that's how I put it across, that anybody who is overweight, more than 33.5 with comorbidities, or BMI more than 37.5, suddenly they may be doubt, what is this BMI? All this BMI we measure to a height, how much weight you should be. There are definite criteria, and it's easy way for you to check yourself. If you have been gaining weight, so a lot of people are doubtful, see how I need to know that I have gained weight. So your pant size is increasing, your weighing size of your clothes are increasing, and you in the mirror you see yourself, you have been gaining weight. That's the time you should take help. So I think preoperatively we put them to all this course because the surgery becomes easier, and the respiratory pattern will be easier, and they recover very fast from surgery. So usually the pre-bariatric diets, we give something for about 1 to 14 days.
Yes.
Or if they are super
Liquid
obese,
diet, which are high in protein and low in calories, and less of sugar, and elimination of alcohol, and all simple sugars, all these need to be avoided, so that later on it will, for the surgery also it will be easy, because the liver will be shrunk. That is where, and it is the liver which stores the sugars and fats, and it becomes, especially in a laparoscopic surgery, it becomes easier for the surgeon if there's a weight loss even pre-operatively. That's how dietitian plays a major role, pre-operatively, during the after, immediately after surgery, and also in the long term. So we have seen that patients who have been in regular touch with the dietitian, who come either physically if it is possible, or those who are in touch with a dietitian, they have better results in their weight loss journey. And we always advise them to maintain a food diary, so that we know how much of the protein they are meeting. And sometimes lots of concerns are there for especially youngsters. They may have initially hair loss and all, so they become very panicky, but this is only a temporary phase. And with the proper diet and inclusion of micro as well as macronutrients, and intake of nutritional supplements like vitamin and mineral supplements is also, they might have to take lifelong. And
so in this
yeah.
what happens is, basically, the dietitian, we take their help at different level, the requirements are different. Initially, our main role of dietitian to reduce the liver size, we call it as very low calorie diet, which has all the nutrients. A lot of people are scared when we lose weight, when you're not eating, how we become fit for surgery. But all these diets have lot of nutrients but less of calories. Then once surgery is done, we divide into phase 1, phase 2, phase 3, phase 4. So there are different types of bariatric surgeries, in the sense, so there are surgeries like sleeve gastrectomy, bypass, or single loop gastric bypass. All surgeries require different dietary patterns, and the malabsorption pattern also is different. That's when the dietitian plays a very important role, because nutritionally we assess you preoperatively itself. So again, when you come for follow-up, at least once in a year, we check your B12 levels, iron levels, folic acid levels, to see whether any deficiency and correct you, both in supplements level and the dietary pattern level. So whenever you undergo bariatric surgery like sleeve gastrectomy, it's only a restrictive surgery where the supplements enough to follow it up for 1 year and stop. But if you are going a bypass or a mini gastric bypass, the supplements have to be given lifelong. So that's when you need to follow up with the dietitian. They will guide you. See, there always is a tendency, you may be vegetarian, you may be non-vegetarian. When there's a non-vegetarian, there are a lot of choices. But when a vegetarian, the choices become shorter. Some sort of adjustments in your dietary pattern necessary, which can only be done by the dietitian. And immediately after surgery, see, when you're in phase 1, phase 2, you may not be able to tolerate everything. So that's when we will guide you that you need to take a liquid diet, that is phase 1. Phase 2, we say some sort of all sorts of liquids with a puree type of diet.
Yes.
And that puree slowly becomes very soft diet and slowly becomes normal diet. So whenever we do the surgeries, there is also restriction in your intake. Sometimes if we don't train you properly, unnecessary vomiting, discomfort, pain, all this occur, which we don't want you to have it. So basically, preoperative preparation, dietary management, post-operative nutritional cover-up is necessary for you. It's all in a teamwork. So we work as a team where at different levels, so we can be able to modify your diet and put you in a right pathway. Sometimes when there are diets which you may be taking but they are calorie dense, we definitely will tell you you need to come down on it. The greatest advantage of bariatric surgery is somehow metabolic, it changes you. It makes you feel very good. The appetite comes down. You tend to eat more better and better foods, and the quantity of intake comes down. And the moment you get all those ingredients into your life, not only your old self back, old confidence back, people start listening. They start listening to themselves. They start changing their diet. They start doing activity. 1 month after bariatric surgery, we see a lot of these patients totally their mindset changes. They want to listen more and more. Lot of patients come to us with the thing, will I lose weight? Is it really possible? So from that area, the diet changes and the activity pattern and the way we put you into new way of shaping up. So it really changes, and the best part of it is lot of diseases like diabetes and sleep apnea and some sort of hypertension and osteoarthritis, some of the diseases really disappear. So the success is almost to the tune of 80 to 95%. That's how this bariatric surgery makes it somehow, some light at the end of the tunnel. So, we can remove all the, fear or apprehensions, myths that bariatric surgery is some sort of dangerous thing. And we can put yourself, especially when you come belong to the criteria where your weight overweight and you're having a lot of issues, you're not able to come down on your weight. Bariatric surgery is actually a boon to patients who are suffering with all the disorders. And
most of the post-operative complications like dehydration, constipation, and dumping syndrome, where the gastric emptying is done at a faster rate than normal, then you may have symptoms like dizziness, vomiting, nausea, all these can be taken care of through proper nutritional guidance by a dietitian. So like 30-minute rule, we say 30-minute rule, do not drink water or before 30 minutes and after 30 minutes after a meal. So staying hydrated is really important. So you need to take in small quantities throughout the day, but not just before and after the meals.
so this when we say dumping,
Yeah.
so when you take lot of sugars, we know people have a lot of cravings. So all this dumping, inability to take heavy sugars actually helps you to lose weight.
Yeah.
So only thing is we need to tell you that when you take this, you will get this feeling. So you will be beware of it. So majority of this bypass patients, we encourage them not to take too much of sugars. Sometimes even small quantity, unknowingly if they take alcohol, they get because of the fast absorption,
Yes.
they get all this dumping leg syndrome. So it's very important. We need to guide you, train you, and the surgery is like very comfortable for you. And it's like any other surgery. See, nowadays bariatric surgery is like any other surgeries. And most importantly, I want you to know that the risk involved with bariatric surgery and the benefits what you get of bariatric surgery is highly disproportionate. See, the benefits in the sense with your overweight, the amount of risk you carry is something like 7 to 13%. Like you have 200 times more chance of getting a heart attack, stroke, or 100 times more chance of having problems in your sleep when you have a severe sleep apnea. When you compare to the bariatric surgery, the risk is only about 0.3 to 0.6%. All that also is being taken care of with lots of modern methodologies like doing your Doppler study of your lower limbs to look for any DVT, helping you to improve your respiratory, saturation level before surgery, so that you recover very well after bariatric surgery. So what I want, this is a multimodality type of treatment where every one of us, like surgeon,
They need a
physician,
lot of
dietitian,
psychological support also.
psychological support,
Yes,
yes.
because
So we
and family
often,
support also, that is
yes,
very much important in their weight loss journey. So the quality of life, it really improves post bariatric surgery. And have you seen any cases wherein they require their rebound, weight is rebound, and they have required second
section.
bypass, just
So
like
all,
redo CABG?
yes.
Have you
See,
ever seen? Yeah.
you need to understand, like all surgeries have to be taken care of. See, whenever you've done a bariatric surgery, post and lifelong follow up with your diet and exercise is a must. So if you don't follow up, there is always 10 to 19% of people who gain weight back after 8 to 10 years.
10 years.
So that is the time you need to monitor whoever have undergone bariatric surgery. You need to check yourself. Am I gaining weight? Do I require a opinion? So then we can put you again on the good diet regimes and good activity regimes to bring you back to normal. So this is very important because weight regain after we have been operating for the past 23 years, and we often see this patient coming back. So before going for any sort of redo bariatric surgeries, we need to check you what is the cause for whether your lifestyle
Is it
modification
any
is bad,
hormonal
and most of the
imbalance?
times in alcohol,
Yeah.
and again going back to your old habits.
Yes.
All things needs to be checked, and again we need to put you back into, if you have a tendency for binge eating, alcohol intake, we again require to take with a psychological psychiatric support, and again dietary pattern again has to be changed, again put you on track. So this bariatric surgery and the dietary management and the multimodality management by bariatric and in the weight loss is a lifelong process. It's not like a one day. And when you are undergoing surgery, when we are doing, we have responsibility for you. So we want every bariatric patient who have undergone bariatric surgery not only undergo surgery but also follow up with us properly, so that we can keep you under normal or ideal body weight lifelong.
So discipline is the key. That's what I think. It plays a major
Definitely,
role.
definitely,
So
definitely.
discipline in whether it is with your physical exercise or following the diet or follow up with the consultants, all this play a major role, and we are sure that this will help.
So the
in
best
a
thing
long
is,
improve
the
quality
follow up.
of life.
So we have seen the study says who are on follow up, they have 17% more weight loss than people are not on follow up. So that is the reason why we want you to understand your overweight and obesity, and how majority of health conditions can be treated or cured by this bariatric surgery. And you need not follow the myths which create lot of misunderstanding with you. You can confidently undergo bariatric surgery, be a normal, be ideal person, and go on with your journey of happy life after bariatric surgery. Thank you.